Welcome to the Inside Scope, a podcast from Lakeland Regional Health, where we talk about topics that most interest you. Today, with me in the studio is just me. It's the holidays, so we are going to talk about something that I do called infectious diseases. Now, when I give lectures at high schools and with others, usually it's at lunchtime or dinner time, and I do like to talk about snot and diarrhea, so please, you might need to turn the volume down. So we want to talk about infectious diseases because during the holidays, you might be traveling, you might be gathering together. You want to make sure it's a healthy event. Now, just a little bit about infectious diseases. Doctors can go into many different fields. They can go into surgery. They can go into internal medicine, cardiology. I chose to go into infectious diseases. One of the reasons why is it really allowed me to take care of different parts of the body because infections can occur anywhere. Can occur on the skin, can occur in the liver, the eye, the heart. But also I found the most interesting is we're often asked to see a patient who has fevers. Fevers can be very frustrating. They don't make you feel good. And what's the source of the fever? That's what captured my interest because fevers are not only due to infections. A fever can be due to different things, like sometimes your immune system overreacts. They call that an autoimmune condition, and that might cause a fever. If you've ever heard of a disease like lupus, lupus can cause fevers, rheumatic fever, different forms of your own immune system overreacting can cause fever. Allergies can cause fever. Even things like I think another good example would be even cancer. Cancer can cause a fever. There's no infection, but the actual cancer, this could be the clue to getting rapid treatment and getting on a way to a cure if fever is the only symptom you're having of something like that. So I always found that very interesting. But the other interesting thing is we often get asked about international travel. Now, granted, if folks ask me about their trip that they're planning and how to remain safe, sometimes they cancel the trip after talking to me, so I try to be very careful. And so they might be hearing things about yellow fever or hepatitis or things that can, certain bug bites, but you can travel safely. And one of the things we love to talk about is how to travel safely. For some of you, and this is not just here during the holidays, but some of you might be traveling on a cruise and things like that. There's another disease out there that we warn people about. It's called CSVD. Now, I do ask my students, what is CSVD? And they take all these wild guesses, and I'll have to say, no, it's not that, it's not that. CSVD, cruise ship vacation diarrhea. Oh, you don't want to get that. Explosive diarrhea, projectile vomiting. Don't you like all these terms we use in medicine? That's why I became a doctor. I get to say all these gross things, projectile vomiting and explosive diarrhea. Well, this is a serious issue when it's you. And we do have that going along. Now, this cruise ship vacation diarrhea, I just made that up, but that's caused by norovirus, N-O-R-O virus, norovirus. Very contagious, very hardy. It's hard to kill it. It's hard to even hand sanitizer with alcohol doesn't quite get it off of you. It doesn't destroy it like soap and water does. So you can imagine you're on a cruise ship, and I hate to say it, if you're having diarrhea and you're wiping yourself, it's going to soak through the toilet paper, and trillions of viruses will be on your fingers. If you don't wash your hands and you leave that bathroom and touch elevator buttons, or God forbid you're the person making the salad, you're going to infect other people because, again, it doesn't go through their skin, but as soon as they bite their nails or touch their food, they are getting those viruses, and they're hardy viruses. The norovirus gets through the acid of the stomach and then leads to vomiting, feeling awful. You could get dehydrated and then having diarrhea for a couple days. For those of you who've known somebody with this or you caught it yourself, you get over it. But think about this. If you're elderly and you have to take certain medications to stay healthy, if you're vomiting for a day and you're having lots of diarrhea that dehydrates you, norovirus can be serious for you. So preventing it with soap and water is very important. and be making food in a very careful way that requires the hand washing. So that's another disease that's out there. The last one, I sometimes tell my traveler friends, and I showed the pictures of it, there are some traveling that you want to do really careful things when you travel. You might know not to drink the local water because the folks locally might be used to it, but you might not be, and you might end up with a little bit of a different kind of diarrhea. If you're asked if you want to have water on a trip, you always want to get that water with gas in it. And the reason you want to have water with gas in it is that you know it's definitely pure from the factory, not just filled up by a local tap and then the cap screwed or glued on. The other thing you want to be careful of is ice. Germs can live in ice. Brushing your teeth and washing your mouth out, you want to be careful, with that also. And then another issue about infectious diseases is that we're often asked to see patients who are having a fever. Many times we think the fever is due to an infection by a germ, but we're also trained to know that fever might be caused by something that's not from a germ. It could be the immune system overreacting, like in a condition called lupus. Or sometimes it's an allergy to a medicine can cause a fever. Other times we see it as the first sign of a cancer. So we're always keeping our minds open to different possibilities, even though it might be obviously due to one thing, we often are checking and making sure it's not something else so we get the right diagnosis and then the right treatment. And that makes infectious diseases very exciting. There is another wonderful topic that a lot of folks don't quite realize, and I love mentioning this to kids because we talk about how do germs spread from one person to another. And I usually show them a picture of somebody sneezing and all that snot and stuff going everywhere. And the person is supposed to sneeze into their elbow, but what if they sneeze into their hands? If they're sick, they're putting trillions of germs on their hands. Now, I always ask the kids, if that person were to shake your hand, would you get sick? And they often say yes, but I'd say, no, not so fast. Germs can't get through the skin. Germs have to find another way to get you sick up in here as far as the cold symptoms of sneezing and sore throat. So how does that happen? Well, let me show you one way. I tell the kids to wash their hands, make sure they're washed, go to a mirror, and look very closely at your eye. And I'll show you. You take and you look at your eye and gently pull down on your eyelid and look at the edge of your lower eyelid. Now you follow the edge of your lower eyelid towards your nose, you will find a tiny little hole right there on the edge of your eyelid. And I often ask the kids, what is that hole? Now they'll guess. They'll say it's the tear duct. And I'll say, no, actually the tear gland is up over on this side. And it makes sense because it's making tears 24 hours a day. It makes tears 24 hours a day because you want to keep your eye moist. But on the other hand, we really don't want tears running down our cheeks unless we're watching a really sad movie. But we do want those tears every time we blink to go across our eye. Well, guess where those tears end up? If they're not running down their cheek, those tears are going in that little tiny hole. And that hole is the opening of a tunnel that goes right back to the back of your nose and then down your throat. So go back to the guy that sneezes in his hands, puts trillions of germs on his hands, shakes hands with you, and if you don't wash your hands, you've now got trillions of germs on your fingers. And if you rub your eye, you're putting those germs right there to have your tears wash them right down that hole, down that tunnel, to the back of your nose, and boom, you're sick. I tell the kids you could also pick your nose and they'll go a lot faster, but don't do that. So those are the ways you can get sick with not being careful with your eyes. So we often tell people, wash your hands, but try to avoid touching your eyes. Now, of course, if you have a sick child at home and they sneeze right in your face, well, there's nothing you can do about that. It's in your eyes and in your nose and your face. But if you can, you're touching things all the time that a sick person might have touched. You might be on a plane. You might be in a crowded situation. Just try to keep your fingers from your eyes. Granted, there are germs out there that do float in the air and they get into us that way, but certainly when you touch it, you want to keep your fingers away from your eyes and keep them washed otherwise. And there was also something that I mentioned from a program quite a while ago. Lakeland Regional Health is really strong in academics. We love teaching. We love the idea of thinking about, challenging questions. And I did ask a question that had to do a little bit of the real inside scope. It had to do with the stethoscope. And I show this to a lot of the kids at school, and I'll show them the stethoscope and let them listen to what do we listen to. We listen to the heart. We sometimes listen to certain blood vessels. We listen to the lungs. And we listen to the belly. And this is a great tool. But I asked the students, what's the most important part of the stethoscope? And this was always fun with the elementary kids and all that. They would say it was the bell that collects the sound, or the tubing, or the pieces up here. And I'd say, actually, you can't really see the most important part at the moment. It's because the most important part is the part that goes in between these two parts. And I let them think about it, and they go, like, your head? And I go, yeah, your brain, because this is just a piece of rubber and a piece of metal. It's not going to cure somebody, but it's the doctors and nurses that have their expertise that they know in their brain. They know what they're listening to. They know what's the most important sounds, and it's the brain the most important part. And that's what makes the stethoscope do its job, because you have some caring individuals that are doctors and nurses that know how to use it. So that's the most important part. It's you, the person doing the listening. And with that, I want to wish you the happiest of New Year's and a wonderful holiday, and for all the holidays to come. May you and your family stay in good health. Thank you. Oh, I was reminded that, don't forget, wash your hands frequently. Have a good day.